In this episode of Life's Little Miracles, Chris faces cancer, and Eric gets a smile. "17-year-old Chris Stevenson has been diagnosed with a cancerous tumor on his pancreas.
No more burning.
2 rounds of chemotherapy have not been effective.
You want to unpack some of your stuff, Chris?
Nothing in there.
There's nothing to hang up? No?
Just a t-shirt.
Today, Chris's parents and 3 brothers have brought him to the hospital for surgery to remove the tumor.
So what wrist you want it on? Because don't you put all your IV stuff in that hand?
Oh yeah.
Do you want to...
This one on my wrist.
Sure.
The operation is very high risk, but it is the last chance doctors have to save Chris's life.
So...
I checked with the, they got a video machine coming from the TV. She's gonna go and get one for any other side.
There you go.
Sure, might as well.
There's Chris. He gets the first 2 goals.
Does he really?
He's great.
Hopefully I'm playing hockey again by December, and that way I can get out as quick as possible and play as much hockey as possible.
Oh, yeah. You should hear us down at the arena.
Okay. Let's set up on Mom's.
Hi. Dude, Dr. Henry wants to see you.
Okay, just to recap, you have a tumor in the area head of pancreas, and it's an area where a lot of juices from different organs drain to help you absorb things you eat. Resecting the tumor itself requires removing not only the head of pancreas, but also the first part of small intestine that comes off to the stomach. It is a fairly involved procedure that has significant risks, including potential death from it. Has many complications, and I would expect a minor complication after an operation.
Now, and you mentioned about taking 50% of the pancreas.
The amount itself is not really critical, whether it's 50% or 60%.
Okay.
As long as there is an adequate tissue left behind to function. I'll probably make a sort of slightly, almost the shape of a boomerang. I think that will give us the best exposure. If you were a very narrow person, I would have considered sort of up and down type of a thing, but I think this would be the best way. Cool. Slightly asymmetric, but like a boomerang shaped.
All right. Yep. Very good. Thanks, doctor.
Thank you.
Bye. Take care. So.
Do you feel okay?
Yep.
What he said?
Oh yeah.
Yeah?
It's good. You'll be on those blades skating in no time.
Of course.
Six-year-old Eric Canham has Mobius syndrome, resulting in malformed hands and facial paralysis. Eric has difficulties with speech and cannot smile.
No, I'm going to have some.
We have to take some more pictures.
Last year, Eric traveled from his home in Halifax for surgery on the right side of his face, giving him half a smile.
Very good. Hold the big smile. Hold it, hold it, hold it.
Now, doctors will attempt to complete Eric's smile by operating on his left side.
Very good.
So why don't you have a seat right here, okay?
Can we talk for a minute?
Can we talk for a minute? Of course we can talk for a minute. When did you have your first surgery? Do you remember?
No.
In October. Remember what we did? We took a segment of a muscle from your thigh, and then we moved it up into your face, and we connected it so that when you moved your mouth, you'd be able to smile on that side.
What's that on the bed?
That's my hat. What do you think? You like it?
It looks like a pirate hat.
Pirate's hat.
Oh, pirate's hat.
Can I turn the hat off? No, I did
You want to put it on yourself? Having quite good success with this operation. It's not perfect, as you know, and it doesn't reconstruct every aspect of the facial nerve, but it does provide some support to their lower lip. It allows the lower lip to come up to the upper lip so that it improves their speech, and it also provides a smile and simulates a smile so that they're able to interact more effectively.
Doctor just with his hand.
He's very distinguished looking, isn't he, with his hat, Eric?
The doctor just gonna look handsome.
Oh.
What's
Thanks very
handsome?
much.
What's handsome?
You didn't have to add that last one. That was just funny.
It means he's very good looking,
Okay.
Eric.
I'll see you in the morning, all
so-
right?
Good night, Dr. Zucker.
Hopefully we'll find out in the hour.
Thought he was supposed to go last night.
This morning.
Oh,
8
this
o'clock.
morning.
So everything's put on hold because of the, there's a kidney transplant and they don't have enough
Oh.
ICU beds left.
And if we find out that it is canceled for today, we better get on the phone to the people
Yep,
that were
that's
coming
right.
by, just to let them know.
We're gonna go
They
down.
just called for him to go down.
Oh, you know
Yeah.
what? He's definitely going to be going down now. We just got word.
No,
Thank
we're waiting,
you.
eh?
Bye. Jeff said good luck.
Is that his brother?
Yeah, he's got 3 brothers.
Oh, wow. I'm just going to go see if they called for the transport to come take him.
Okay.
Okay. I'll be right back.
All right, thanks.
You just want to hurry up and get in? Yeah, I don't blame you.
You look a little sleepy, so it won't take much to put you to sleep.
I'm Dr. Kemp. I'm the staff anesthesiologist. We're just wondering, because for your form of pain management, the plan is to put an epidural in to keep you comfortable when you're awake.
How long will you keep the epidural in for then?
Probably for a few days. If you have, every time you cough or breathe, if it's your stomach and they cut across the muscles like that, it's kind of uncomfortable.
Okay. You want to say your goodbyes?
Okay. Well, we know he's in the best care in the world.
We'll take good care of him.
Yeah. We've known that for a long time. Okay.
Oh, can't do that.
Sorry.
Shake my hand. We'll see you in a little while.
Yeah.
Where? Be good.
The dentition is all right, eh?
Yep. Take good care of him. You'll be sleeping. It's the people that are awake that it's hardest for.
Eric, can you squeeze your lips together? Do your best. Oh, good one. Good for you. Good for you. Good job. Because now I want to see your big smile. Great big smile. Come on, come on. Oh my goodness, have you ever? Wow. There's his dimple. Oh, it's amazing. Look at that. Oh, two. Yes. Oh, good stuff. Okay, let's just have a little try on here. There we go. So that will just sit like that. Looks good, Eric. I think it will do the trick. There we go.
The head anesthetist came out and talked to us once he was completely under, and they got all the tubes and everything, and so she said that went well.
I guess we should be coming up, huh? Very muscular. Probably has more muscle in this area than the entire my body put together. He's a hockey player, isn't he? Such a big trauma getting into the abdomen, isn't it? We're in the belly. So this is the his tumor draped over a piece of his duodenum, and we mobilized it. We're just freeing it up to assess neck to make sure that this is resectable. More in the vesical area.
See you smile now.
Great big one. Your biggest one that you have. Great big one. Ooh, great big one. Nice dimples.
It's Mom.
I didn't go into that this time.
I got dressed so I can go into the operating room.
Let me try this one.
Okay.
Here's a little match, and it's got a smell of strawberries. You want to smell the little strawberries for us?
You go right
There you
ahead.
go.
You put it yourself.
Excellent.
So proud of you. Mama's big boy. Oh.
Okay, Mommy's just drifting off to sleep there.
Oh.
Okie doke.
Thank you very much.
Okay, sports fans, let's just take this lump out. It's resectable, and if it's a local disease, it is curable for this child. I'm quite pleased that it is. Yeah. Okay. That's okay. We don't have to get into the second part. Okay, back tumor out.
What did you take out there, Peter?
Duodenum, pancreas. Come down internally. Yeah, come on. Okay. Sit down.
Well?
Well. Okay. And we were able to completely resect the tumor. The tumor was contained in the area. Looking at the rest of the abdomen around the region, everything looked like it was just contained in that area. He's got at least somewhere between, I would think, somewhere between 40 to 50% of pancreas left.
Oh, thank you so much.
Thank you.
You're welcome.
Gosh.
Thank you, Doctor.
You're welcome.
Thank you. Thanks for looking after our son.
Not at all. Okay.
No, I better not go out there crying. I think it's bad news.
Is it okay?
Yep.
All done?
Oh, that's good. All done? Oh. I could have kissed him.
Yeah, well.
That's Eric's pillow. You miss Eric, don't you? You wonder where he is. It's Eric's pillow.
This is the muscle which we prepared to put in the face, and it's been divided. It's now the right length to go in the face.
Okay, now we put the cheek flap back and we'll sew it up. So this is the hook that the occupational therapist made yesterday for him. And it will tend to reduce the likelihood of the already reconstructed side pulling against the part that we just repaired. So it just sits in gently like that. Everything worked out great.
Thank you.
The muscle sat in very nicely. It was in very good position. I was quite happy with it. Had an excellent circulation when we took the clamps off the blood vessels. The circulation to the entire muscle was perfect. Everything looks good.
Good.
Thank
you, Dr. Zucker, again.
Okay, you're welcome.
Good work. Excellent work as usual. Thank you.
Thank you, Dr. Zucker.
He's all done surgery now. He's going to recovery.
After he's all
I'm
finished
going to go see him later. You can give him a big kiss.
Hey, Chris. Dad's here, bud. Is it gone?
It's gone,
It's gone.
baby. It's gone.
they did the surgery faster
Sorry, bud.
than
Here.
they originally told us. But
Yeah, just put your hand down.
everything
Just
just
wanna hold your
went
hand.
great. No?
More.
Yeah, right there. We're just blowing it by. So
It's drying up my throat.
you know what that is? It's humidified oxygen.
It's got humidity.
It actually will help moisten your throat.
But it's really dry.
I know. That's because you can't drink right now, sweetie. Okay.
You're the bravest guy I've ever seen.
Chris, Grandma and Aunt Colleen are here.
Yep.
Uncle Rick's here.
Yep, they're all there, buddy.
Here.
Everybody's there for you.
Kind of staying with us. Okay, can we just slow down a little bit? Say hi to your family.
There's Grandma and Uncle Rick.
Hey, buddy, how are you? Yeah.
We'll see you when you get a little better.
Take care, buddy. Back to sleep.
Right.
Oh, we've got to stay here.
Oh no.
You okay?
Yeah. I've done this a few times today, Rick.
Yeah.
No question.
Long day since 6:30.
Hi.
Did you get Christopher?
Yes?
Okay, what time?
He's here now. Just
2 seconds
arrived.
ago.
Can we have the admit team?
The calcium is 1.83.
Okay.
Next.
Okay. I'm just gonna get you all set up. Check your temperature and stuff. Okay.
You must be hungry, huh? You haven't eaten much since your surgery.
Tonight.
We'll see tonight. What the nurse says is okay. You can have a 10-bit, okay? But Dr. Zucker said you shouldn't have any today. Hi, darling. I like your shades.
He's had a great night. He's doing so well. Oh, yeah. Made you feel better?
Hey, that's not
Did you know I'm proud of you?
How are you feeling?
Pretty good.
Pretty good? Any complaints?
Last night I got really hot.
Don't worry about these little oozes. I like it to be oozed out like that. This is why I taped it rather than sort of completely sealing it.
No, we were just asking this morning about the actual tumor that was taken out.
Yes.
And I was just asking if it was going to be examined. And Dr. Wales said, yes, it'll be dissected.
To them to slice them up into little pieces and examine all the edges of them. It will be at least 2 more days.
Right.
I mean, at this point on, after surgical trauma, I feel it's just a matter of waiting for him to heal.
Great, thanks.
Thanks, Dr. Kim. Oh, that sounds great.
Yeah.
Good for you.
This is Dr. office.
Fabulous smile. You look so happy.
How much does it weigh?
I'll tell you. Big smile now on the other side. It's the same. 15 and 15. That's perfect. And here's a little hat for you. Alrighty.
I want day to call me Dr. Elwood.
What a good idea.
Right now I got to do some operating.
You have to do some operating now? Okay, well, good luck.
Shake my hand before I go.
All right, shake your hand before you go. Wish you well.
Thank you, Dr. Zucker.
Oh, you're very welcome.
Thank you.
I'm glad it all worked out well for you.
Oh.
You'll be able to get more air down to the bottom. So let's try sitting up, see if we can have a listen to your back, okay? So, try and get your right elbow.
Our left side kills. That's the problem. The right side's fine.
Pull it off. Okay.
Get it under.
All right, I got it.
Good, 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 good. Are you okay? What's wrong?
Pain.
First time's always the hardest, Chris. You're doing really well. Oh, goodness. Fantastic. You okay?
Good boy.
All right.
Excellent.
Amazing.
Super.
You okay? There's a pillow behind you if you want to lean back.
While Chris is determined to regain his strength and play hockey, he faces a painful and challenging recovery.
Okay, do you think you can stay up for a little while longer?
I don't know.
Lightheaded again?
Let us know how you feel. Do you want to go back to bed?
Stay up for a little longer.
Yeah.
Until pathology completes their examination, Chris and his family will not know if the surgery has removed all of his cancer. In the next episode of Life's Little Miracles, Chris's struggle with cancer continues, and Sydney's chance to see